Hey there, I'm Nell, and today we're going to learn how COVID has affected our food industries, our children, and our adults. This video will go over how COVID has affected food in all of our lives. Now, you may be asking, what is COVID-19? The United States CDC defines COVID-19 as a new disease caused by a novel or new coronavirus that has not previously been seen in humans. This is a cause of an outbreak of respiratory illness that was first detected in Wuhan, China. Since December of 2019, there have been growing numbers of cases in multiple countries all around the world. But in the United States, there are two studies being done that suggest COVID-19 originated in either Washington State in late January to early February or in Los Angeles last December. For these studies, one study was published in the Journal of Medical Internet Research and looked at the past 5 years' worth of electronic health records from a healthcare system in Los Angeles. Now, these records were combed through for cases where people who had cough as one of their medical complaints, a common COVID-19 symptom. These records were used as a backlog to establish a baseline to figure out how many people were sick with complaints during roughly 2014-2015, and then it was compared to the 2019-2020 winter. Now, researchers looked at these years side by side and found that the number of cases involving coughs started to rise in around December 22nd of 2019, which continued to February 2020, which is where the theory that COVID started in Los Angeles is coming from. Now, the other theory that COVID started in Washington in late January, early February, was based upon samples that were analyzed and collected in Washington state. The first COVID-19 case, a person who returned from China on January 19th, was listed as the first COVID case. Now, the first confirmed case of COVID in the United States was on January 24th. Now, around the end of March, early April, that's when we see our numbers start to spike, and that is when our food industry started taking such a big hit. COVID-19 has affected our food in multiple areas. It's affected our food supply, our school systems, our restaurants and fast food services, our grocery stores, and more organizations have been donating to families in need. Now, when numbers started spiking up on COVID in late March, early April, there were a lot of processing plants that started getting shut down and meat producers that started getting shut down. And I remember this because we would go to the grocery store and there would be no chicken anywhere in the store.